I'm Vanila Singh. I'm a physician anesthesiologist and pain doctor, as well as a regional anesthesiologist at Stanford. I'm a professor, and I sit on our scientific planning committee of the American Society of Regional Anesthesia. I also sit on the health information subcommittee of the California Medical Association, and I'm not sure why I got on that committee, but I think it has something to do with practicing in Silicon Valley. And I kind of want to just actually take a moment, thank Marcy again for all that she's doing, chairing this committee, the vice chairs, all of you, and especially Congressman Sessions. He really has been and continues to be a great friend to physicians. And over the last few years, I've been able to watch how much he does. He has a son who's in medical school. I don't know if you guys know that. But there are very few people who go to bat and create a forum where we can actually speak like this. We're all involved in many different organizations, and so I think we have to continue to support him as well. Having said that, I kind of wanted to take a step back, if we could go to the next slide, and just talk about how we got here. The health information technology field is really a hit job, and it basically encompasses so much of the problems that we're talking about today. If you think about what Dr. Lockhart mentioned with MACRA and the implementation, the poll of 100,000 doctors, if you really step back and look at how all of this came into being, information technology has been rising since the 1960s, but with the American Recovery and Reinvestment Act, it really actually made it mandatory to get EMR and EHR with physicians. And that really pushed into this entire sector that has just been growing like anything. And when I started to dig in and went to the HIMSS conference, which I don't know if you guys know, but it's like the largest conference for health information technology. I went last month. There's 640 corporations that were present, corporations that have never had anything to do with healthcare but are now there, Oracle, Cisco, and whatnot. And it astounded me. And also at this conference, there was a lot of discussion and banners everywhere about curing disease, improving healthcare, that with really no physician or clinician presence. And there's a great belief out there that information technology is going to improve outcomes in healthcare, as we see with MACRA, measurable objectives. And I think it really starts with people who get involved with the industry who just don't know what they don't know. And much of that is also because of the absence of physicians. Our profession makes us the stewards of what we do in practice, and we heard that today by the stories out in Missouri. And I think that we, perhaps by being busy, maybe because in our own training haven't had advocacy as part of our curriculum, because maybe perhaps we're a profession and we see ourselves not advocating for ourselves as a bad thing, but we have been left out of the conversation. And what I find in all these forums is that we're reacting to that which has all happened. And so this is all kind of come about because I saw that this horse is really out of barn. I mean, it's gone. And I think right now what I was trying to think of and consider is that we really need to be proactive about things that are already occurring, and they're occurring at a really quick and fast rate. So health information technology really encompasses not just EMR and EHR, as we all know. It doesn't just cover quality care payments and alternative payment models and MACRA. It also encompasses precision medicine, which I think actually one good part to it is that the NIH defines that as having care that is individualized with an ear towards genetics, lifestyle, environmental issues, and I think that can certainly lead to better things. We had a great speaker last year, exactly a year ago, at our Physicians Council, who spoke about targeted breast cancer treatments. It made sense. That's the kind of scientific innovation I think we're all for. However, much of the other stuff in information technology can be very concerning. The most interesting was artificial intelligence and machine learning, which I will get into in a minute. And then the fourth pillar that I found that was really huge was, as a result of all the data collection and big data, cybersecurity, of course, has become a bigger issue because of the protected health information. So this is a huge growing industry that it has, for example, Google had, I think just a couple years ago, no starter projects involving AI, but now has. The mandate for EMR, once again, was definitively started in this last presidential administration, but there was a movement that started sooner than that. At Stanford, we actually used EMR. It was in 2009, so I've been doing it for 8 years with Epic. There are great issues. It's, of course, disrupted our workflow, particularly in the clinic settings. It has also affected our time with the patient, precious time that we use for objective diagnosis, objective discussion, and of course that's all going into data collection. I don't know, how many people here are on EMR? Right, so we all know, everybody knows the disruption is huge. It is bigger and more present, and it is growing at such a great rate right now that we have to sort of see where it's headed and then put our imprint on it. Otherwise, it will go without us, which is what it's already proven to do, which is why we're talking about MACRA and the objectionable objectives, right, instead of being a part of that conversation. So I think having policy positions about where we think things are headed would be a very useful outcome of today's meeting. The industry has grown in health information technology. I was telling you that there are non-traditional corporations that have never been a part of healthcare. It was really fascinating to see all the Silicon Valley companies there that do other things, but they were all at the healthcare conference, all very, very much a part of it. Apple, Google, and the likes of Facebook. They're all going to be a part of it. Next slide, please. So actually, we can go to the next slide after this. Thank you. So to AI and machine learning, this is something that I kind of thought was a great example of saying where health information technology is going to lead. AI has been around also since the 1950s. In the 1980s. It is a vast sort of synthetic intelligence that involves neural networks, psychology, philosophy, and it is being taught. It's like a brain that they're creating. And one of the key things was when Kasparov was defeated by a computer in chess, and it's very much going to end up impacting medicine. And I've heard talk out there, a lot of folks are doing startup companies, Accenture and all these folks that already have goals. They believe by 2035, AI could double growth. And so they're really pitching it from an economic perspective, a means to augment human behavior, but the sights are set on medicine. And I'll give you another example. In ophthalmology, the pictures of ophthalmologic disease are already being taught to computers, and then what they're saying out there is that those computers are doing a better job in diagnosis than the physicians. And certainly, I think that it could augment it perhaps, but I think once again, this is being sold because the industry incentives are there. And unless we get involved, again, I think much will happen. And even though it's not right, things happen without it being right, and then we're left trying to pick up the pieces. So I thought that was really fascinating that the machine learning is moving at speeds that many people already talk about it replacing physicians on some level. So that is something that was astounding. The sites are already set, and I think that it would be great if we start to, maybe as a group, do our own research and come up with some policy positions about the ethics and empathy and whatnot regarding that. Next slide, please. So also our positions on EHR, EMR, where do we see this going? I mean, I think that there's a consensus here. Everybody would raise their hands that we do believe it impacts workflow. We do think that it takes valuable time away from our patient practices. Those are things that I think that we have to come out with a position and ensure that our leaders in healthcare acknowledge that and understand that it's significant, it's across specialties, that we don't have turf wars about this, and to limit further mandates and perhaps reverse them. Next slide, please. So the goals, I mean, I think that what we want to see is that we are forward thinking. We believe in scientific advancements that support medical treatment of human diseases, but that has to be parsed out from the support of these other industries. Health IT, in conclusion, is I think, a major stakeholder. It's hospitals, it's insurance companies, and it's technology. And they are going to fight to get their piece of the pie. Where some of that could lead to some improved innovation, I think we really have to be very strong in what we believe is important scientific advancements that help us with our patient care. I recommend physician oversight to mandates, reduce data collection in terms of what we believe is actually useful data. This is the big data era. It's all over the place. How that data is collected, what that data is, and whether it's meaningful or not, and also how data can be manipulated. It all has to be considered as part of this. And in the end, I think it's really our own oversight and ethics and empathy that will play a huge role. But that's it. And I don't mean to lower the excitement, but I do believe that there's a lot going out there, and there are companies that, if physicians perhaps got involved, would be very happy to get them on board, because it certainly legitimizes what their goals are. So thank you very much.